When you need medical help fast, use NHS 111 online to go from home to an urgent treatment centre
Mr. Williams, please come through.
or a pharmacy.
Hello, pharmacist will see you now.
Or if needed, stay where you are and get a call from a nurse, doctor or paramedic. Get assessed and directed to the right place for you in as little as 90 seconds. Use NHS 111 online.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi, and welcome to this episode of Our People podcast. I'm your host, Harry Newhouse, and I'm a PR and social media assistant here at STSFT. On this week's episode, I have the pleasure of speaking to consultant clinical psychologist Sonia Wilson and clinical psychologist Sarah Markham. Sonia and Sarah both work within our psychological services team. This includes supporting both patients and staff with mental health difficulties. I'll be chatting to Sonia and Sarah about their roles, our staff support service Thrive, and how important it is for us to look after the well-being of our staff, which means they can continue to deliver excellent patient care. Welcome to the podcast, ladies.
Thank you.
So early in February, it was Time to Talk Day, which is the world's biggest mental health conversation. With this in mind, we expanded this throughout the whole of February to share how staff can access support for their mental well-being. One of our staff support services is called Thrive. Could you explain what Thrive is and what your roles are within the service?
Would you like to go
Yes,
first, Sarah?
Yes, I can do. So I'm Sarah and I'm the clinical psychologist within the service, but also the Thrive clinical team lead. So I'm very new in role. I started in January. Before this I was in Northumbria Healthcare for 4 years, again in staff psychology. And my role within Thrive is to provide some one-to-one clinical support for staff directly, psychological therapies, and then I also do some leadership and management. So I line manage the team, and in regards to the leadership stuff, it's thinking about the strategy of how we can widen the mental health initiative within the trust as well.
So my name's Sonia, and I'm the head of our clinical health psychology department in the trust, so I'm responsible for all the services that sit within the department, and for the last 2 years I've been involved in setting Thrive up, recruiting the team, thinking about our sort of referral pathways, and the support that we offer both for sort of staff one-to-one but also the team support and training that we do, and now Sarah is in post, I'll start to take a little bit more of a back seat with that work but still support sort of Sarah with leadership and management as required. Yeah.
Brilliant. And I know that Thrive offers a wide variety of support, such as one-to-one and group or team sessions. How beneficial is this kind of support to our staff?
Well, I believe that's really beneficial. I think that the staff are kind of the beating heart of the trust, and without our staff being well, then they're not going to be able to provide great care for our patients as well, but also they're not going to be able to enjoy kind of coming to work, and it's such a big part of our life being at work that to kind of thrive at work is really important.
Sonia, even though it's a service run by the trust, for trust staff, it's still all confidential, isn't it?
Yes, so accessing any sort of healthcare service, we would ensure that confidentiality is a given. However, there are limits to that in terms of if a staff member is at risk in any way, we would have a duty of care to ensure that that staff member was kept safe. However, all that discussion around what that would mean is had with a staff member when they make contact with the service.
You have also introduced Schwartz rounds. Could you explain a little bit about what Schwartz rounds are?
Yes, it's a little bit of a funny name, but they're named after the man who, I guess, invented them, came up with them, and they're based on his experience of accessing cancer care and seeing the emotional impact of working in healthcare. He wanted to develop a model of care and support for staff, which is where Schwartz rounds were invented. They're an internationally recognised sort of reflective practice sort of programme, and they have a very structured format, so staff working in health and social care settings, and that doesn't have to just be clinical roles, it can be non-clinical roles as well. come together and you have 3 people who share stories, usually on a similar theme or topic, and then that is discussed with the wider group in terms of how that sort of resonates with them, which bits of the story they identify with or feel familiar, or aspects of the emotional and social sort of impact of the work is explored together. And the Schwartz rounds that we've run in the Trust have all been sort of really highly evaluated, and people have found them really helpful. We've had themes such as A Patient I'll Never Forget, spinning plates, I guess just the reality of having to juggle lots of different demands, both at work and outside of work.
We've started to do kind of bespoke ones, haven't we?
Yeah.
Mini Schwartz rounds where teams are coming to us if they want a particular kind of reflective practice space, and we're supporting them to think about kind of what they would like to talk about and supporting them to get the panel of 3 together. So at the moment, that's the route that we're doing, is those kind of the teams coming to us and saying, actually, we'd really like to have one of these implemented within our service, and we're supporting them with that.
The last one we did was with medical students, just thinking about the challenges of sort of going from training to qualified, and some of the common sort of anxieties and concerns and worries about that transition, which was really, again, really popular and really well evaluated.
And more recently, you also started doing wellbeing walks for staff. How much of a positive impact does being outdoors and physical activity have on your mental health?
Yeah, so the wellbeing walks, they're kind of increasing in number by the month, actually. So I think last over the last 2 months we've had 70 odd people kind of coming along to the wellbeing walks, which is fantastic. And we've started to do them on weekends as well, and I think we're going to be piloting with family and pets being able to go along as well on the walk, just to make it more accessible as kind of the lunchtime weekday walks and some evening ones. And the reason why we were thinking about wellbeing walks is because, as you say, we are aware of the positive impact that being outdoors has on our wellbeing. So we know that getting sunlight and fresh air can really help aid things like sleep and aid our mood as well. And particularly if we can be outside in kind of nature and greenery, there's a lot of evidence that can really boost our mood as well. The great thing about the wellbeing walks is that it creates kind of a social element as well, so people can chat, so that can improve things like, you know, loneliness as well, and that sense of well-being and connection with colleagues as well, and if family members can come along. I actually, when we were out and about last week kind of promoting Thrive and the Time to Talk, a few people came up to us talking about how they'd been doing the wellbeing walks, and somebody mentioned how it was really, really helpful to have it contracted almost and booked in and timetabled in, because although you could go for a walk anytime, really having that kind of scheduled meant that they were motivated to do it and they were really, really enjoying it.
And whereabouts are the walks? Do you have different routes?
Yeah, there are different routes, and the timetables and meeting places and everything are on the intranet, and also I think on the Time to Talk diary that I think Jade's been involved in developing.
They also post on the staff Facebook page as well, so we try to have a few lunchtime walks a week, running from different sites across the trust, and then usually there's a weekend walk as well, sort of planned. So. And
Sarah, why is it important that as an employer we look after our staff in this way? Thrive is obviously a service for staff, but what impact does it have on the care our patients receive?
So I think there's numerous reasons why it's important that we look after our staff in this way, and I think even just having an in-house service means that what we're doing hopefully is reducing stigma and normalising the fact that we all have mental health, and therefore we can at times all struggle with our mental health as well and need that support. We know that particularly over the past few years with pandemics, winter pressures, austerity, all of the things that are going on, that it does have an impact on our staff. It's been very demanding, the pandemic in particular, where a lot of people were being told to stay at home. Our staff were actually, being told to come in and kind of keep going, but they were also facing kind of the same worries and concerns as everyone. So I think it's really important that we do look after our staff. We know that having positive mental health helps them feel more engaged at work. It improves their performance and their sense of achievement as well. We know that healthcare staff often are very high on compassion for others. They're often very dutiful, so we'll tend to give a lot to others but not necessarily kind of give much to themselves and kind of think about self-care. So that can lead to the potential of kind of burnout as well, compassion fatigue, that sort of thing. So it's really important to provide that support for them, which is why we don't just do one-to-one, but we also do teamwork as well, because of things like compassion fatigue, burnout, moral injury, trauma support as well. And we also know that there is a high level of kind of presenteeism, so people who maybe don't feel well enough really to be at work, but who will still come into work because they don't want to be off. They worry about their team, and worry about being off, so they're coming in, but they're not necessarily performing at their best. They're actually starting to feel worse. So it's by us providing that support for staff in-house, it means that we can be responsive to the needs of staff as well. And in regards to how it impacts on the care our patients receive, we know that there's a direct link with how, with staff wellbeing and patient care. So there's better quality patient care, and patients feel more looked after if our staff are healthy, engaged at work.
No, I think I would agree. Sort of the research sort of shows that, I guess, if we look after our staff, that has a direct impact on patient care and patient outcomes. And I think given the current time within the NHS, now more than ever, it's really important that we look after our staff and keep staff well, given all of the additional pressures and stresses. That's not always an easy answer as to how we do that. And as Sarah said, we offer both that one-to-one support, but also thinking how we bolster our teams, because they provide a really sort of big safety net and buffer in terms of that sort of peer support for staff members. So certainly within Thrive, we wanted to have both what we would say is the reactive supports when people are in need, that they can access that sort of one-to-one support very quickly and directly. However, we also wanted to look at preventative measures, which is where the wellbeing walks come in, the Schwartz rounds, the training that Thrive offer in terms of resilience, sort of stress management, mental health awareness. I'm sure Sarah will be able to go on with a list of that, to try and ensure that we support people to be as equipped as possible in what is really challenging times. And I think it's acknowledging the work that can be done with an individual, but also within the team and the organisation as a whole.
Yeah, I agree. I think as well that when people hear the word resilience, they often think that it means that people are saying, oh, you as an individual need to be resilient and the problem lies with you. But actually, we're wanting to think about resilience as within team resilience as well, and kind of organisational resilience, because it kind of comes at all levels. It's not just down to the individual staff member, but if we can support them to boost their kind of own resources and coping skills that they've got, whilst also, as Sonia said, looking at the preventative stuff that we can do within teams, upskilling people to feel confident and competent to identify mental health difficulties, to be able to talk about them, to be able to know where to signpost as well and what support's available. That should really help with kind of supporting the individual as well. So I think it's just important for people to realise as well that when we talk about individual resilience or resilience, we're not saying that it's all down to kind of one person to kind of have to cope with that really and manage that, or it's their responsibility. It's thinking about kind of the wider systems as well, and that's what we're trying to do here at Thrive.
And I think that the fact that Trust have invested in Thrive and have developed this in-house service highlights the value and the importance that the Trust is putting on staff wellbeing, and that they are at that, as you said, the heart of the organisation.
Yeah, because the Trust have, we've done quite a lot, so we've done like the big money team talk to try and engage with our staff, so it's good to know that the Trust are getting highly involved with the staff mental health. How big is the Thrive team?
So the Thrive team currently consists of myself as the team lead. I'm also one of the psychologists that provides one-to-one interventions, and the model that I use, well, I'm very integrative, but I have a special interest in compassion-focused therapy and acceptance and commitment therapy, and how that can support kind of healthcare staff that we support. We have another a counselling psychologist, Elizabeth James, and she also provides one-to-one psychological support as well, using a range of different models and approaches as well. And then we have 2 counsellors within the team. We have Karen and we have Victoria, and they are fantastic, and we've been having really positive feedback about the counselling that they provide for our staff. And then we have Liv, who is our assistant psychologist, and she is one of the key contacts for the wellbeing walks. So people will often see her out and about on the wellbeing walks and promoting things on social media to do with the wellbeing walks. She's also delivers some of the training alongside Elizabeth. And she's also the main person who does the triages. So Liv might be the first person that people speak to after Emma, our lovely admin as well. And then we have Sonia as well, who oversees it all.
For our staff who may need support from Thrive, how can they get in touch and find out more information?
So they can call our number directly, which is 0191 569 9699, and come through and make a self-referral through that contact number, or they can email stsft.thrive@nhs.net, and if there's any requests for team support, for wanting to put in a self-referral, training requests, anything like that, then they can drop us an email or ring up, and most likely if they ring, they're most likely to get Emma, our lovely admin, who is often the first port of call. So for staff and teams who would like some support, we've also got our intranet homepage, which has different sections on there, including the links to things like the wellbeing walks, but also links to team support as well. And when we think about kind of the team support that we offer, we do offer that kind of more reactive team support. So if there's been perhaps a critical incident within a team, such as a sudden bereavement of a colleague, or a loss of a patient that's been quite traumatic, for example, then we can provide that kind of more responsive team support, provide some psychological debrief, and also support the seniors to just make sure that they feel supported, that we're providing the right information to normalise those situations as well, because understandably people are going to be potentially feeling emotional after something quite distressing. So we provide that sort of reactive support, but then also we provide training for teams as well. So we're currently piloting line manager training for mental health awareness. We're going through the first round of that training at the moment, and then we've got a couple of dates coming up, one in April and one in May. We've got the resilience and wellbeing kind of training, which are for staff to come along to. We've got a bereavement support group for staff as well. So those are just some of the examples of some of the training that we do. But what we would like to encourage people to do is, there is, as I've said, the team support sections on the intranet. And what we would really encourage people to do as well is, if they have any queries about how to support the wellbeing, the mental health and wellbeing of their teams, to contact us, to reach out, and we can do a little bit of consultancy. We can do a little bit of an assessment with them to find out what the needs are and what kind of interventions might be beneficial for them, whether it's reactive and responsive in the moment, or whether it's that proactive stuff, so we can really help build that within team resilience.
There is a specific form on the intranet for teams to fill in for team support, and what we try to do is link up with our colleagues in organisational leadership development, equality, diversity and inclusion, chaplaincy, HR and occupational health and wellbeing, to all come together to think actually what's the best support for those teams and for us to have a think together. So hopefully on the back of that sort of form and understanding kind of what the difficulty is, we all work together to think actually who's the best person to support that team and what's the best intervention, and evaluate it.
Yeah, and how quickly will the staff be seen to once they get in touch?
Very quickly for the triage assessment. So basically what will happen is, once they've got in touch and said they would like to self-refer, somebody from the team will be in touch with them to complete the referral form and a bit of an assessment as well. And then we're roughly about a month.
So I think depending after that initial assessment, we decide if it's deemed that sort of seeing one of our counsellors, Karen or Victoria, is more suitable, then their sort of waiting time is around 20 days. And if it's to see one of the psychologists, so either Sarah or Elizabeth, who work within the team, that's roughly around a month at the moment. But depending on sort of referrals and sort of holidays and things like that, things do sort of peak and drop a lot. But we would say sort of around about 23 weeks for counselling and a month for psychology. And if there's additional support that can be offered between then as well. So we would encourage a staff member to contact, and all of this will be discussed and sort of fitted to their needs.
Sonia, can you remind us where can our patients or residents of South Tyneside and Sunderland where they can go for help if they are struggling emotionally or mentally?
Yes, so within Sunderland we have our psychological wellbeing service that is run by our local mental health trust, CNTW, and staff can contact that service on 0191 566 5454, and for patients who live in South Tyneside they can access the life cycle service, and they can self-refer by contacting 0191 283 2937, and people can self-refer to those services.
Thank you, Sonia and Sarah, for coming to talk to me today about Thrive and why it's important for both our staff and patients that we offer this support. For more information about what is happening at our trust, visit our website at www.stsft.nhs.uk or follow us on our Facebook, Twitter or Instagram pages. We hope you have enjoyed listening to today's episode and hope you all tune in for the next one. Thank you once again.
Thank you.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.